All right, welcome everyone to our webinar tonight with Dr. Maria Show. We're going to be talking about women's health issues tonight. And just before I introduce Dr. Show, I would like to just let you know that I'll be sending out the PDF for the slides you're going to be seeing tonight, tomorrow, along with the quiz for those of you who need a verification letter confirming your attendance at the webinar for either CEU credits or practicum hours. So I just wanted to let you know that up front. So I'm going to begin by introducing Dr. Show. Dr. Marita Show is a graduate of the Canadian College of Naturopathic Medicine, and she has a thriving practice in Victoria, BC. She's also an educator for Preferred Nutrition and for Natural Factors, and she talks and educates people about women's health issues all over North America. And she believes in that optimal wellness is achieved by identifying the fundamental cause of disease through individualized patient care. By removing physical, mental, and emotional barriers to health, Dr. Show believes that this goal can be achieved. So we're really pleased to welcome Dr. Marita Show to speak with us tonight. Hi, Marita.
Hi.
So I will leave it up to you now. You can take it away and call up your PowerPoint, and off we go. This is the fun part.
Oh, you know what? My PowerPoint just disappeared.
Okay, so you've still got it open, right?
No.
Okay, reopen it, and then go into, then go to View, and click on, I forget what it is. I think it's full screen or something like that, and it should pop up.
Now?
Yes, we got it. Perfect. Excellent.
Woo! Well, thank you so much for that lovely intro, and thank you for having me this evening for the webinar. Really, really excited to give this presentation on alarming trends in women's health. And as was mentioned, one of my greatest passions and why I became a naturopathic physician in the first place was for to be able to educate the public. And by working with Preferred Nutrition and Natural Factors, I definitely get to do that all over North America, but I also obviously get to do that in my clinical practice. So I do have a special interest in women's health. There you can see a picture of myself in my office, and I know when I attend conferences, I really love hearing about case studies. So I will be discussing some case studies or sharing with you some case studies of real patients that I've treated in my practice, and I will be talking to you also about some of the products that I've been using in my clinical practice with great success. Obviously, from Preferred Nutrition, it's one of my companies that I do prescribe from. And to give you a little bit of background information before I get started with the presentation, you know, I know that a lot of you, it gets overwhelmed because there's so many companies out there that have really, really excellent supplements and products. And I have to say, probably before I even became associated with Preferred Nutrition about 7 years ago, my patients were actually the ones that were coming in to me telling me about the formulas. And so before I even started educating for them, I was actually using the products. So yeah, so you will see some of those products being mentioned in the presentation this evening. So alarming trends in women's health. Definitely, I'm sure that these are going to be some of the trends that you're going to be seeing when you're out there seeing clients and helping them, you know, improve their health. I'd probably say fatigue is a huge one. You know, especially with working women, they're trying to manage the home, they're working full time, you know, they're trying to maintain balance, so eating well, exercising. So I see a lot of women coming into my practice that are exhausted most days or every day, just feeling overwhelmed in general. With that, insomnia, of course, high stress. We'll talk about, how stress definitely impacts all of our other hormones, as well as our sleep hormone, melatonin. So I see a lot of insomnia in my practice, as well as depression and anxiety. And the frightening thing that I'm noticing a lot is that it's happening in a lot younger children, younger girls. So I'm seeing a lot of girls in their teens or even younger, like 12, 13, having issues with anxiety and depression. We'll talk also about the environmental toxins and how that plays a role as well with hormone balance. The other thing that I'm seeing too is a lot of women going through early menopause. So premature ovarian failure. So even women who are, 37, 38, experiencing changes in their cycle, hot flashes, night sweats, which is another thing that I think is, again, related to our environment. And then I already mentioned, stress is a big one. So back to the basics. So what does that mean? Now, I find that we often forget about the basics. And I think that, all of you being nutritionists, holistic nutritionists, and me being a naturopathic physician, we know that the basics is really that foundation to making people feel really, really good. Supplements are important as well, but if we don't have that foundation, then really we can't optimize how well those supplements are going to work. And you might think, oh, this is common sense. People know this, but you know what? A lot of people don't realize or they forget about the importance of good fats, and adequate fiber, protein, water, and exercise, and just moving your body. Avoiding excessive stimulants, that's a question that I always ask my patients. Are you having 2, 3, 4, 5 cups of coffee a day? Are you getting any other forms of caffeine, say in black teas, in energy drinks? So those are really important questions to ask when you're talking to clients. The other thing too is that there's a lot of confusion out there with clients, with my patients. What they may think is healthy, like the sort of to-go smoothies, like the naked drinks, what they may think are really healthy are actually packed full of sugar and that are actually going to be doing more damage than good. So again, a lot more education that's our job to be doing with our clients and our patients. So the importance of protein, obviously a very, very important building block. It's important for our hormones, healthy hormone balance, our serotonin levels, dopamine levels. Adequate levels of protein also cause a very important hormonal response, which controls our appetite and helps to also burn fat. So another thing that I didn't mention in alarming trends in women's health is, a lot of women really struggle with weight, and a lot of that has to do with not feeling great, low energy, not sleeping, so they really lack the motivation to make those changes. There was a study actually from the American Journal of Clinical Nutrition that found that just an increase in dietary protein from 15% to 30%, but get this, with the exact same carbohydrate intake, produced a sustained decrease in appetite and caloric intake, and also resulted in significant weight loss. So I often use this study to kind of help motivate my patients to just start getting in more protein. I'm like, listen to this, you just need to start increasing that protein, and then slowly we start educating about what are important carbohydrates, complex versus simple, and really making sure that we can control that metabolic rate. Fat or sugar is a primary fuel. So, we know that the majority of the public out there is using sugar as a primary fuel, carbs, carbs, carbs. But, there's a lot more diets and studies coming out. I don't know if you guys are familiar with the Bulletproof Coffee diet and book that's mostly big out here on the West Coast. I don't know if it's reached out to Ontario, but talking about like high fat diet. And I'm not saying, that's all you need to do, but we know that old fat stored around the body, thighs or butt, cannot be burned off effectively unless we have new fat coming in from our diet. And that's that's the one important thing, is we really need to, again, educate what kind of fat is healthy. Not the hydrogenated trans fats, but, you know, things like the coconut oil, a lot of things that you're already familiar with, nuts and seeds, avocado, you know, animal fat in moderation. There was a really interesting study actually done by the Harvard School of Public Health and this was specifically found that women who consume nuts or nut butters 5 times a week or more significantly lowered the risk for type 2 diabetes, so by almost 30%, compared to those who never ate nuts or nut butter. So again, getting in those healthy foods helps to curb the appetite, and it helps to really curb those cravings for those junk foods. Fiber and estrogen, probably a review for you guys, but you know, adequate levels of fiber, really important for bowel health, also helps to eliminate and bind onto harmful estrogens that build up in the body. So there was actually an interesting study that was done by the University of Toronto that determined that young girls who actually consume more than 25 grams of fiber daily in the form of whole grains, fruits and vegetables, were actually 50% less likely to experience early onset of the menstrual cycle. So what we're finding is, as I mentioned before, premature ovarian syndrome, where women are going through menopause earlier. But what the other thing that we're noticing is that, or what I'm noticing and my colleagues are noticing, is that, you know, girls are developing a lot earlier as well. And again, I think it has a lot to do with our environment, plastics, phthalates, you know, so again, a lot more education that needs to be done with respect to that. So fiber is a great way to really help to eliminate those excess harmful estrogens. Sitting is the new smoking. I don't know if any of you have heard of this tagline before, but I've heard it a few times now, and you know, I think it's very, very true if we think about, you know, I know for a lot of my patients, I've started asking them now, like, how many hours, like if you could rate how many hours do you sit during the day, a lot of them will say, you know, 6, 7, 8 hours, and they're like, oh, but you know what, I'm not really counting my hours that I'm commuting or my hours when I'm sort of relaxing, you know, when I'm at home. So there was an interesting study that showed that even the 30 minutes that, you know, we may do because we have really good intentions of exercising, 30 minutes at the gym in the morning may not do enough to really counteract the detrimental effects of 8 to 10 hours of sitting during the day. So they're now linking, obviously, this sedentary lifestyle with type 2 diabetes, metabolic syndrome, heart disease. So really important that, you know, people really get up and move. And I know, you know, for people that have desk jobs, that might be difficult, but I say, you know, if you're going out for coffee or tea, you know, make sure you're up walking around, or even every hour get up, have, you know, an exercise ball in your office where you can do a little bit of stretching. Just getting up and moving and getting the blood circulation, so important. So on to stress. We talked about how stress is obviously a big factor, especially stress is on the rise for women. There was a big survey that was done by the American Psychological Association that did find that almost half of all women surveyed said that their stress levels have increased over the past 5 years. We know that chronic stress puts your health at risk for virtually, I mean, stress affects every system in the body, to your neurotransmitters in your brain, to how you control blood sugars, to how you deal with inflammation, your immune system. You know, again, big review for you guys. But I thought it was a pretty funny stat. If you can read the last stat, married women report higher levels of stress than single women. I kind of get a kick out of that one. So the importance of cortisol. So I find with cortisol, sometimes cortisol gets a bad rap. And, you know, I think it's important to acknowledge the fact that cortisol is actually essential for us to live. It's when chronic stress, when we're in contact with chronic stress and our cortisol levels spike or our cortisol levels plummet, that's when it becomes a huge issue, and then we have to look back and really look at what's happening with the adrenal glands. But just some stats on the importance of cortisol, like what it does for the body. It does help to stimulate the liver to convert amino acids to glucose. It stimulates glycogen in the liver, mobilizes fatty acids into the blood, increases coagulation, suppresses the inflammatory response, so it does help. It's our natural way of helping to control inflammation, prevents loss of sodium in the urine, maintains resistance to stress, and also maintains mood and emotional stability. So what happens with too much cortisol when we have chronic stress? Belly fat. So we get stimulates fat deposits. It increases protein breakdown. We know that it's related to demineralization of bone. That's why when people are put on corticosteroids long term, often they're checking bone density. They're often putting people on bisphosphonate drugs as well to counteract the detrimental effects of being on a corticosteroid long term, such as prednisone. Suppresses the immune system, memory loss, low mood and anxiety, sleep, libido, testosterone, muscle loss, and then of course it increases and fuels the desire of cravings, carbs and fatty foods, so all your junk food. So this was a study actually that was done just to show that when people are actually in contact with a stressor and cortisol levels do significantly increase, they actually measured testosterone levels as well as free T4 and T3. And it did show that, big surprise, when cortisol levels spike, when we're stressed, testosterone levels do reduce within 12 hours, and also it does suppress the thyroid function with reduction in free T4 as well as free T3, and then that increases your thyroid stimulating hormone. So it basically results in hypothyroidism, low thyroid. The other thing, too, that happens is it doesn't just disrupt your thyroid, but we also know when cortisol increases, it does affect your progesterone levels, estrogen, DHEA, and testosterone. So all those do decrease. And this is often referred to as a progesterone steal. So you can see at the next chart, it shows that, some of the main hormones that are produced by the adrenal glands, adrenaline, noradrenaline, also known as epinephrine and norepinephrine, aldosterone that helps to control blood pressure. And you can see down at the bottom there on the left-hand side, there's cortisol. So to feed the increased demand of cortisol when we're stressed out, it does draw from progesterone. And in somebody who's menstruating regularly, and this is how sort of fertility can play a role, or women that come in that have menstrual irregularities, this chronic stress can definitely affect the ratio, like the progesterone-estrogen balance, because to feed that increased demand of cortisol, you're going to decrease your progesterone levels, and then what's going to happen is often that if you have lower progesterone levels, your estrogen levels, there'll be that imbalance in the higher estrogen levels, resulting in estrogen dominance. The other thing that can happen, though, is with that increased cortisol demand, you can draw from progesterone, and if the stress is actually occurring long term, it'll actually eventually start reducing your levels of your DHEA, testosterone, and your estrogen as well. And this is going to be, we're going to revisit this when we talk about menopause, but this is a really, really important concept that you have to remember when we deal with hormone foundation. Yes, we talked about sort of the basics, and diet and nutrition and exercise are important, but I believe with regards to adrenal support, virtually I'd probably say like 99% of my patients are on adrenal support, especially if there's an underlying hormonal dysfunction, and especially if they are going through perimenopause and menopause for this reason, because the more stressed out you are, you're actually depleting a lot of your other sex steroid hormones, because your adrenal glands do produce small amounts of those hormones as well. So adrenal health, the foundation. So we know that if your adrenals aren't functioning optimally, that does lead to low thyroid. We are going to be talking about low thyroid in just a moment. All other hormonal imbalances, menopause, sleep is a big one. I'd probably say also when I'm dealing with insomnia, whether it's women that can't fall asleep, or they're able to fall asleep, but then they're waking up multiple times in the night. Typically, when I check for cortisol levels, typically cortisol levels are out of balance. Typically, they're higher in the evening versus in the morning. So I am often treating adrenal function with sleep issues, as well as mood and anxiety, depression. Digestion is a big one as well. Not sure if you're familiar with this, but they have done studies that have shown that high cortisol results in the reduction of your good flora in your gut. So that's why a lot of times when people have had a lot of stress, you know, they either it'll result in irritable bowel symptoms, can result in ulcers, it can result in digestive complaints like constipation, diarrhea. The other thing that high cortisol, when with respect to gut, that can happen is there's an antibody called IgE or IgA. It's an IgA antibody that is a protected antibody for all of our mucosal membranes, especially within the intestines and your gut. So with high cortisol, with chronic stress, the IgA antibody can be greatly depressed as well. So again, leading to irritable bowel syndrome, but even inflammatory bowel disease, such as ulcerative colitis and Crohn's. And you know, I just actually had a patient who had come in who's been chronically stressed for many, many, many years. And interestingly enough, she didn't really have a lot of, and again, the other thing you have to remember is not every case you're going to see is textbook. That's one thing that I've learned practicing for the last 10 years is it's not always textbook. But she'd come in and she'd had a long history of stress, but not really a lot of bowel issues. She's like, you know, I've had really good, you know, bowel movements, no constipation, don't really get bloated, make it bloated a little bit here and there. And, you know, she's just been diagnosed with Crohn's disease. So, you know, here's somebody that really didn't complain a lot about digestive health, although has had high stress and anxiety for many, many years, and has just been diagnosed with full-blown Crohn's disease. So really interesting. And then, of course, again, adrenal health, poor inflammatory responses, and immune health can also be related to poor adrenals. So one of my products, my kind of go-to for adrenal support is the Women's Sense Adrenasense formula.
Marita, before you go on, you cut out when you said what she'd been diagnosed with.
Oh, sorry. She'd been diagnosed with Crohn's disease.
Okay, thanks. All right, go ahead.
Okay, thanks. So Adrenasense is by the Women's Sense Preferred Nutrition Women's Sense line. And I'm not going to go through every ingredient of all these products because I'm sure a lot of you are familiar with the ingredients. But I've just sort of isolated certain ingredients with certain studies. For example, rhodiola. Everyone's familiar with how powerful of an herb rhodiola is, especially as an adaptogenic herb. And with regards to rhodiola and you know, students pulling all-nighters, we know that rhodiola helps to increase that resistance to stress, helps with mental performance, general well-being, also helps to reduce any issues with mental fatigue, also improves sleep patterns, mood stability. And this is, you know, these aren't huge doses. This is 50 milligrams twice a day, which is 100 milligrams per day. And then Siberian ginseng, I don't know if any of you have heard of Dr. Karen Jensen, who's also a naturopathic physician. She's now retired, but she's been a great mentor for me, and she actually is the formulator of Adrenasense. She's also a master herbalist as well as a naturopathic physician. But we often would talk about Eleutherococcus and Siberian ginseng because a lot of people find because it's a ginseng, even though it's not a true ginseng, they think, oh, ginseng, don't take it because it causes your blood pressure to increase. Now, we know that holds true for people that have a history of high blood pressure and they take licorice extract. But I thought I would just include an interesting study that was done with regards to Eleutherococcus, and people that were exposed to a stressor, and then what they did is they measured heart rate as well as blood pressure when these people were given Eleutherococcus. And actually, the Siberian ginseng helped to reduce or normalize heart rate as well as blood pressure when they were exposed to the stressor. So we know that it actually helps, again, as an adaptogen to help the body increase its resistance and help it adapt to a stressor. These are the other ingredients that are found in the Adrenasense. So rhodiola, this is per 2 capsules, suma, Siberian ginseng, schisandra, and ashwagandha. Ashwagandha is a great herb as well, especially for just overall well-being, but also for the thyroid, which we'll talk about in just one moment. The dosage, I typically recommend 1 capsule 3 times daily. However, I typically recommend adrenal support earlier in the day, so I will often recommend either 2 with breakfast and 1 with lunch, or, you know, if they have to take it all at the same time, to remember to take it, because I find when you split the dosage, sometimes people forget to take their second dosage. They could even do 3 capsules with breakfast as well. So I mentioned that I was going to share with you some of my case studies. So one of my first case studies that I was going to share with you, is a 51-year-old female that came in very, very high stress, married, type 2 diabetes, perimenopausal. So she was coming in with mild hot flashes, really, really tired all the time. She said, you know, I'm not coping well at all, feeling overwhelmed most of the time. Her fasting blood sugars were quite high, so 9.2. At this time, I didn't get a chance to check her hemoglobin A1C, but that is sort of my preferred test now. To check blood sugars is the HbA1c, because it gives you sort of more of an average, whereas your fasting blood sugars is just sort of a snapshot. But having seen her blood sugars being at 9.2 and the normal is less than 5.5, I said, you know, I think it's kind of safe to say that you are type 2 diabetes in this particular case. And her hemoglobin A1C was tested, and it was quite high as well. There is a test that I do with a lot of my high-stress patients, especially high-stress women. It's called a Konigsberg test. It is a urine test. I know that the preferred method for testing cortisol is usually salivary cortisol testing. Now, I try to make it, you know, as affordable as possible for a lot of my patients. A lot of the salivary cortisol testing can get really expensive, so this is just more of a, you know, an easy test that I can do in-house that gives me an overall indirect measurement of how well the adrenals are functioning. So my protocol with her was definitely gave her some adrenal support. I gave her some probiotics, and then again, you know, she wasn't taking any supplements at all, so I gave her just basics like good fish oil, B100 complex to add with the AdrenaSense, and I will often do that. You know, I will often combine those adaptogenic herbs with, you know, magnesium or your B vitamins and vitamin C. So, you know, all those really important nourishing adrenal supplements. Vitamin D, and then we did a lot with diet. In her case, she didn't know it. She knew very, very little as far as, you know, eating well. You know, her doctor was kind of getting ready to write her a prescription for metformin. Didn't really give her the option of trying to, you know, straighten out her diet and start exercising. But however, her doctor did say, you know what, I'm going to give you, you know, 4 months to get yourself on track. And she's like, if you can't get your blood sugars down, you know, we're really going to have to look at conventional intervention. So, you know, this was enough of a scare for her that she took things really seriously. She started exercising. She started eating really cleanly. She, you know, got more fiber in her diet, got more veggies, protein, cut out a lot of the junk foods. And in 3 months, her blood sugars did reduce from 9.2 to 7.6. Adrenals improved. And then as a bonus, what happens when you start eating and exercising really well, your metabolism kicks in. She did lose 15 pounds, which she was really, really happy about. Energy levels improved. Hot flashes actually disappeared, and she was coping a lot better. So again, in this sort of situation, high stress, perimenopausal, and just being in perimenopause, that's a lot of stress on the body because the hormones are fluctuating. But, you know, she saw the benefits of really working hard with her diet, because really her diet was very, very much refined carb rich based on her blood sugars, and she saw the benefits in really straightening that with a healthy diet. So she's doing much, much better now. So on to thyroid health. You know, I think when all of you are, you know, in practice and you're seeing clients, or some of you that are already seeing clients, I believe that thyroid health is a really, really big issue, especially amongst women. A lot more women do suffer from thyroid disease, especially low thyroid. There are also a lot of people, unfortunately, that go undiagnosed with regards to thyroid health. So I can probably say every single day somebody comes into my office and I will say, oh, well, have you had your thyroid checked? And they'll say, oh, I've had my thyroid checked, but yes, I'm not feeling great. I can't lose weight. I'm not sleeping. My moods aren't great. But my doctor says my thyroid levels are fine. And then I get a requisition and I get the blood test results sent to me, and their thyroid is not fine. It's within the clinical reference range, but it's not within the optimal reference range. Or the doctor's only tested one piece of the puzzle, which is your TSH, and we know that it's much more than just your TSH levels. You need to properly, if you want to properly assess thyroid function, you need to have your TSH levels tested, your T3, your T4, and then even your antibodies are very important as well, because we're seeing a lot more, or I'm seeing a lot more underlying autoimmune thyroid diseases. Why is there so much thyroid dysfunction? Well, I mentioned before that adrenal stress, chronic stress, high cortisol does suppress thyroid function, especially the production of your main thyroid hormones, T4 and T3. Poor inflammatory responses. So again, if you have chronic inflammation in your body, then it does also drain thyroid function. Diet, gluten, goitrogens, nutritional insufficiencies, so iodine deficiencies, selenium deficiencies, those will also affect thyroid dysfunction. There's even medications. So birth control pill, hormone replacement therapy can affect the thyroid, beta blockers, and of course radiation. And then of course there's the toxins, so environmental toxins. So perchlorates, bromates, PCBs, phthalates, dioxin, triclosan, and heavy metals also have a huge affinity for the thyroid gland. Lead, mercury, aluminum, cadmium, and there was actually a good friend of mine was diagnosed with actually thyroid cancer a few years ago, and super healthy, exercises, eats organic, everything. And when we did a little bit more digging, because we were trying to figure out how could a really healthy individual be diagnosed with thyroid cancer at also such a young age, we found that her heavy metals were actually sky high. And she grew up in an environment or in a community where, a very industrial community where pulp mills and coal burning. So we think that that's probably part of why her body was more predisposed to developing it, because of the heavy metal buildup. But those are also really important questions to ask when you're doing, your case taking is, where did you grow up? Do you have mercury amalgams? Did you grow up on a farm with pesticides, or grow up in an industrial area? So those are really important questions to ask, especially with respect to environmental toxins, and especially heavy metals. So thyroid hormone, just a review, thyroid hormone production does start with the hypothalamus, and it signals the pituitary gland to release, I mentioned, TSH, which is your thyroid stimulating hormone, and that's the typical test that most medical doctors will test, is the TSH. But we know that a lot of people can have normal TSH values but have very low levels of their most metabolically active thyroid hormone, which is your T3. Now, your body does produce more T4 than T3, but then there's this conversion that happens in the body where your body converts the T4 peripherally. A little bit happens in the thyroid, but peripherally it does happen in the liver and the kidneys and other organs, where it will actually convert T4 into your more bioactive thyroid hormone, which is your T3. So stress and thyroid, I mentioned this already before, but just to reiterate, stress does suppress the release of TRH, which triggers the pituitary release of TSH, and then also affects the release of T4 and T3. We also know that there are a lot of women that have issues with converting, even just converting T4 and T3. So they might be producing a lot of T4 in itself, but they're not actually producing enough of that bioactive T3 hormone. And another one of the causes for that is, again, high cortisol. So high cortisol can definitely block that. And a lot of people can actually produce a hormone called reverse T3, which I'm sure you've heard of. And now reverse T3 T3 actually is a hormone that you don't want to be produced in large quantities in the body because, again, it suppresses your thyroid function, and then it leads to a lot of low thyroid symptoms such as lethargy, low metabolic rate, and also affects a lot of your brain chemistry. Now, I know it can get quite confusing with respect to the thyroid and adrenals, and reason being is if you look at this chart that I put up there, a lot of the symptoms are very similar. So, you might see somebody that comes in that says, oh, I swear it's my thyroid, but it might be their thyroid, but there's also this underlying adrenal issue going on. Or maybe their thyroid's okay, and it was always always the adrenals. So when I look at thyroid health, I'm always assessing adrenal function, or if I'm treating the thyroid, I'm always treating the adrenals alongside, because a lot of the time the adrenals is sort of the underlying root cause or the culprit that's affecting the thyroid. So you again look at the other list as the other slide I put on about why is there so much thyroid dysfunction. So if you've assessed the diet, you've assessed the environmental toxins, and there's somebody who's coming in that's like stressed to the max, not coping well, but also has thyroid issues, you want to make sure you're treating the adrenals as well. And in some cases, for a mild thyroid issue, like low thyroid issue, in some cases, I've just treated the adrenals. I've said, let's just start with treating your adrenals. You treat the adrenals, it lessens the stress on the thyroid, and the thyroid actually starts working better on its own. It almost like bounces back because it doesn't have that additional deficiency or stress from the adrenals in the first place. Thyroid medication, there will be people that you're going to see that are already on thyroid medication. So this would be Synthroid or even Armour or desiccated thyroid. That is a combination of T4 and T3. Synthroid is just T4. But it's interesting, some information, and you may already be familiar with this. We know that coffee, obviously you don't want to be drinking coffee with your supplements, let alone your thyroid medication, but there was a research study that actually showed that drinking your coffee or espresso within an hour of taking your Synthroid medication, it really, really greatly reduces the absorption and how well that medication is going to work. So that's another really important question to ask, and I think it's an important educational tool for your clients to, if they're even taking a thyroid support, whether it's nutraceutical or pharmaceutical, to really make sure they're not drinking coffee within that hour. Calcium, iron, and zinc also interfere with thyroid medication. And then it's really important consistency, I find, with thyroid support, whether it's medication or even thyroid supplements. So every day at the same time in the morning, or before bed is also very, very critical. I like to kind of recommend it earlier in the morning. I think people just remember it a lot easier, and then it tends to help people feel better earlier in the morning as well. So one of the products that I like to recommend that I often will combine with the Adrenasense formula, so adaptogens plus thyroid support, is the ThyroSense. So it is going to help to optimize T4 and T3 production, help with that conversion. A lot of the ingredients, again, as far as the ashwagandha, the glucolipids, are shown. There's research that shows that they do help with that conversion of T4 into more active T3 thyroid hormone. Also, iodine is absolutely essential for both T4 and T3 production. And again, just to mention this, which was mentioned before, with cortisol levels, we know during stress, cortisol levels that are increased will decrease T4, T3, and it'll actually even remain, those levels will remain depressed even a few days after the stressor has been taken away. So we know stress does play absolutely a huge role with thyroid health. These are the other ingredients that are found in the ThyroSense formula, so iodine, copper, manganese, tyrosine, ashwagandha, I mentioned, lipids, pantothenic acid. So 2 capsules I usually recommend with breakfast. So even those people that are taking low thyroid medications such as Synthroid, you can actually take the ThyroSense with it because it'll optimize that medication the Synthroid being just T4. The other thing to remember, though, is you never want to take any kind of medication right with your supplements. So the one thing that I do recommend is making sure that you're spacing it by at least an hour to 2 hours from when they're taking their Synthroid. The other thing I should mention is that the ThyroSense is only indicated for low thyroid function, so it is strictly contraindicated for people that are hyperthyroid. Now, it's probably very rare that you would see somebody with hyperthyroidism. I've only seen it in 10 years once in my clinical practice, but most people that I've treated may have had hyperthyroidism, but then they've had surgery to remove their thyroid, or they've had their thyroid irradiated, unfortunately, and that has resulted in them having a low thyroid. So my next case study, a 33-year-old female, already diagnosed with low thyroid, on Synthroid, a history of insomnia. She was coming in because she was really finding it difficult losing weight, low energy. She was having very painful cycles and a lot of anxiety. So her TSH levels were just borderline. Now, we didn't talk about sort of where you kind of want like your optimal levels of your TSH to be. So thyroid stimulating hormone, if you look at the clinical values, are 0.45 to 4.5. They've changed that recently. It used to be a much larger reference range. I think it was 0.45 to 5.5, but they were finding a lot of people even in that 4.5 to 5.5 range were still exhibiting a lot of subclinical hypothyroid symptoms. So 3.7 is kind of borderline, because really where you want your TSH value to be for an optimally functioning thyroid is you want it to be below 2. And I've had patients that actually feel their best between like 1 and 1.5 as far as like a really optimally functioning thyroid. So 3.7, she definitely was out of range. She did come back with stressed adrenals, and she did have a history of a pulmonary embolism, I know at a very young age, from being on the birth control pill for many, many years. And we always hear about how the birth control pill, there's an increased risk of clots, but when you actually do an intake, a history intake, and you actually meet somebody who that happens to, it's quite frightening, because, at the time she was in her late 20s, and, late 20s, chest pain, you don't really think of pulmonary embolism or clots in her lungs, and she ended up, healthy girl, ended up having her lungs full of clots, and the only thing the doctor can think that it was from was being on the birth control pill at quite a young age. So needless to say, she's not on the birth control pill anymore. But we put her obviously on some really good adrenal support. I gave her an additional, just one ThyroSense to take with the Synthroid. And then I also put her on a product called EstroSense, really, really awesome product that I use very, very frequently in my practice for, it's a liver supportive formula. Tranquil Sleep, Pharma-GABA, fish oil, and then also some vitamin D. 2 weeks later, she started improving. She was responding quite well. Energy was improving slowly, and she did lose a little bit of weight, which was great. And then sleep was improving. She was still waking up, but she was able to fall back to sleep a lot easier, and she did feel more calm in general. And then 6 weeks later, I did test her TSH levels again, and they came back down to 2.9. So, which told me that, okay, we're definitely, moving in the right direction. We just have, probably another 6 to 8 weeks to go, and then it'll be, closer to 2 or where we want it to be. So environmental toxins. This is another, I'd probably say another big passion of mine, environmental medicine, because I think, and a lot of you are going to see this if you're not already seeing it quite regularly, especially how it's affecting women, it's affecting children, like autism, ADD, hyperactivity, poor emotional control, anxiety, depression, and even men are obviously being exposed to environmental toxins, and it can affect their hormones as well. But if you look at the billions of pounds of toxic chemicals that are released in our environment by industries every year, many of these toxins are recognized carcinogens, which is pretty scary. And you have to remember also, you know, I'm giving you all this information, and then some of this information you may be looking at and you're like, oh, you know what, I know about the environmental toxins and I know how they affect the hormones and whatnot. But, you know, I'm giving you this information so that you can relay it in an easy, understandable way. You can relay it to your clients and your customers, because you know, a lot of people, again, have no idea that styrofoam is bad. They have no idea that the foundation that they're using from Lancome is bad or is affecting their hormones, or the fact that they dye their hair, you know, every 6 to 8 weeks. That has a bearing on how they're feeling. So, again, education, very, very important for us to get that message out, that it's not just what people are putting, you know, in their bodies, but also what they're putting on their bodies or what they're exposing themselves to. So this is kind of a scary fact, but there's an average of 2,000 newly synthesized chemicals each year that is registered by the American government. Cosmetics are a big one as far as chemicals. And then if we look at the chemicals that are added to our food, and then also the chemicals that are added to a lot of our pesticides. The Environmental Working Group website is a great website. I use it as a resource for a lot of my patients. I've created a lot of handouts for my patients as far as like the Dirty Dozen and the Clean 15. What are some ingredients from cosmetics to watch out for? So I encourage you to check that out, and again, create some really great handouts, even talking about plastics and BPA and where it's found. Again, really, really important, I think, to help initiate you know, good health and being proactive. Toxins, and specifically women. I don't know if you heard or you read this report that was done by a company that I think it's actually a natural deodorant company, and they found that an average woman's daily makeup routine hosts about 515 different synthetic chemicals on her body every single day. So that's a little bit excessive. I think those are for the people that are maybe using like the mousse and the hairspray and the foundation and, you know, the perfumes and everything fragranced. But, you know, we know that a lot of the chemicals like the phthalates and the parabens, these are the reason why they're so bad is that they're carcinogens, but as far as relating to women's health and hormones, they're classified as very harmful xenoestrogens, so estrogen mimickers. The Journal of Environmental Health Perspectives actually found that even minuscule concentrations of estrogen-upsetting chemicals in our environment are capable of causing endocrine disruption within just 60 seconds of exposure. So again, fairly frightening. Just a little bit of a hormone review: estradiol, estrone, and estriol. So E1, E2, and E3. I know estriol is not on this particular chart, but it's in my next one. But E1 and E2, so estrone and estradiol, convert back and forth. These tend to be our strongest hormones, but these are also the ones, when you look at the metabolic breakdown that happens in the liver, is that with the xenoestrogens like the BPAs and the phthalates, they will mimic the strongest estrogens and create those 16-alpha-hydroxyestrones, those very, very harmful bad estrogens, versus the 2-hydroxyestrones, the good estrogens, which have more of a protective role in the body and help to support healthy breasts, healthy periods, and healthy estrogen-progesterone ratios. When we look at just again the 2,16 alpha hydroxy estrone ratios, and these are actually, you can actually get tests done, urine or even blood tests that will test your ratio of your bad estrogen metabolites versus to your good estrogen metabolites. But we know the ones that really, really drive the good estrogens are, you know, DIM, indole-3-carbinol, exercise, omega-3s, progesterone, and then the ones that actually inhibit this enzyme are your pesticides, too much alcohol. Anything that's going to put more stress on the liver or even the digestive system is going to affect how well we produce more of the good estrogens. The 16 alpha hydroxyestrones, so things that are going to initiate more of the bad harmful metabolites, are again your xenoestrogens, low thyroid, and then again any thyroid, or not thyroid, liver congestion. So resources for minimizing the toxic load, again, I'm just giving you information that you can pass on to clients, but again, educating about plastics, beauty products. Also, safecosmetics.org is also an excellent website if you haven't already checked that out. I mentioned EWG, liver support, so educating people about, doing a healthy cleanse, healthy eating, juicing, and then also organic. So again, the Dirty Dozen and the Clean 15, it's a great chart that the Environmental Working Group updates every year. I don't know if you guys even know what the Dirty Dozen and the Clean 15 are, but it's just the fruits and vegetables, so your produce that are highest in pesticide residue versus your lowest pesticide residue. So again, really, really great tools and resources. So EstroSense, I mentioned the product, liver supportive. So for people that have estrogen dominance, what does that mean? People that have hormonal acne, painful periods, heavy periods, a history of endometriosis, fibroids, cysts, anything that's related to an imbalance of more of the bad estrogen versus good, or people that, I have nail technicians, like estheticians that come in and they're exposed to all those chemicals when they're doing the gel nails. Those people are obviously getting a lot of those estrogens. I'm recommending the EstroSense. One of the ingredients that is found in the EstroSense formula is indole-3 carbinol, IC3. I did just pick out one study that was done on cervical dysplasia. So interesting study. Fairly small study, but still I think a very effective study. These women were confirmed with stage 2 or stage 3 of cervical dysplasia, and they were randomized to receive placebo 200 or 400 milligrams of I3C for 12 weeks. So they did biopsy before, and then they did a biopsy after. And what they actually found was, the majority of the people that were taking the 200 or 400 milligrams of the I3C had complete regression. Not all of them, but a high percentage of them did have complete regression based on the biopsy. These are the other ingredients that are found in the EstroSense formula, so I3C, calcium D-glucarate, and then also obviously antioxidants like green tea extract, lycopene, rosemary extract, liver supportive herbs, milk thistle, turmeric, curcumin, also potent antioxidant, but also liver protective, and then of course your sulforaphane. So because we talk about, or I mentioned how the environment plays such a huge role, especially environmental toxins. This is almost like a preventative strategy. I take it myself preventatively, 1 to 2 capsules a day, just to keep my hormones healthy and to keep my liver supported. So it's kind of, one of those general maintenance formulas that, I have my patients on your vitamin D, your fish oil, and then, a nice hormone balancer, liver supportive like the EstroSense. So 1 to 2 capsules a day as maintenance, or if you're treating estrogen dominance, whether it's, irregular cycles, painful cycles, hormonal acne, fibroids, I would definitely recommend it in a higher dosage, at least 4, if not 6 a day. Case study number 3. Woman came in, heavy periods, high stress, married, emergency medical dispatcher, also family history of breast cancer. So with the heavy and long periods, she did have mildly low iron. So as a emergency medical dispatcher, 911 dispatcher, you can just imagine that her stress levels were sky high. She definitely did have exhausted adrenals. And so my protocol with her was I gave her adrenal support, I gave her liver support. I also put her on a product called VeinSense that has a combination of diosmin and butcher's broom, witch hazel, just to help strengthen the venous system, because she did come in with a flare-up of hemorrhoids, vitamin C, bioflavonoids, iron, fish oil, vitamin D. She did tend to run a lot, and we have to remember that running is okay and exercise isn't bad in moderation, but when you have exhausted adrenals and you're running about 40 to 50 kilometers a week, that's a little bit excessive. So we did reduce her running and introduced a little bit of yoga and also eliminated her coffee. And she was sort of my pride patient. She did everything I told her to do. They're my favorite patients. But you know what? It actually resulted in some great feedback. Her next period was normal. She felt more relaxed, coping better. hemorrhoids were gone within 7 days, and adrenals improving as well. So she's one of those patients, and I do treat a lot of nurses, 911 operators. I do treat a lot of police officers. So that shift work is really, really hard on the adrenal system. So that's something that I always, I always check in with them. They're always on really, really good adrenal support. I know I only have 5 minutes left here. I just have a few more slides to go through just regards to menopause. This is a big one too. I'm sure you're going to see a lot of menopausal women, especially for hot flashes and night sweats. One stat, 4,000 new women enter menopause every day. So that's a lot of miserable women that are that I'm seeing, but also you are going to be seeing with hot flashes, night sweats, and insomnia are the big ones. A lot of women are definitely, again, looking back to the adrenals and menopause, but a lot of women are looking for natural alternatives because of the big Women's Health Initiative study that came out. So they're really looking, a lot of people or women that come in, they just really don't want to go the hormone route with hormone replacement therapy. I do have prescription rights here in British Columbia, so I can prescribe hormones, but I will only prescribe bioidentical hormones, and I only prescribe them in very select cases, so it's not sort of my first line of treatment. I do definitely try to treat with lifestyle, diet, adrenals, herbs, before anything. So remember before I was talking about, adrenals, it's very, very, the adrenals are your stress glands, and they're very important to support them in menopause. One of the biggest reasons is because the adrenal glands, we kind of forget that they also produce small amounts of estrogen, progesterone, and testosterone. So when you have exhausted adrenals, by the time you reach menopause, that can be really, really hard on the body and add additional stress on that whole transition, especially when the ovaries shut down hormone production. So again, when you're looking at hot flashes and night sweats in menopausal women, the underlying, and you're always looking at the underlying root cause, is treating the adrenals to make sure that they really have that additional hormonal support. So the MenoSense is the product that I use for a lot of my patients with regards to their menopausal symptoms. The ingredients you can see there, black cohosh. A lot of people have heard of black cohosh being great for hot flashes and night sweats. Vitex also is a great one, chaste berry. But I like this synergistic blend of the ingredients, and I have used this a lot for women weaning them off of their hormones if they're coming in, whether they're on synthetic or bioidentical hormones. You can use this to wean them off, as well as use the adrenal support. 2 capsules twice daily, breakfast and dinner, if someone's coming in with extreme menopausal symptoms. But if they're just sort of in that perimenopausal phase, usually 2 capsules a day dosed after dinner does the trick. Last case study that I wanted to share with you, a woman that was coming in, hot flashes, insomnia, in menopause, brain fog is another big one that I see a lot in practice, celiac disease, so she still was coming in with a lot of stomach pain. With celiac disease and Crohn's and ulcerative colitis, like any malabsorption diseases, obviously you're going to see a lot of vitamin and mineral deficiencies. So she had them across the board, so low iron, hemoglobin, B12, vitamin D, and she had high C reactive protein levels too, which is an inflammatory marker, and her adrenals were quite stressed. And my protocol with her is I gave her both the MenoSense and the Adrenasense. I gave her good doses of vitamin D, fish oil, acidophilus. We also did, I didn't mention this on this slide, but we also did a lot of gut repair, a gut repair protocol as well, and also acidophilus, and continued with the elimination of gluten, but she was still eating a lot of dairy, so we had her eliminate the dairy as well. So 2 weeks later, sleep improved, more focused and clear, brain fog was lifting, hot flashes were almost gone. So I think with decreasing the dairy, that helped to decrease the inflammation, which also helped with her hormones getting a little bit more in balance. And then stomach pain improved and just feeling much, much better overall. So I'm going to just end. I know we talked about stress sort of earlier on. But I'm just going to end with a really interesting TED Talk that I watched, and I don't know how many of you have seen the TED Talks or are into the TED Talks, or even know what a TED Talk is. But they're really great, very short, inspirational speeches, and they can be by doctors, psychologists, environmentalists. And I think this quote, it is psychological rather than physiological stress that is implicated in serious health issues, will kind of give you an idea of like this study that this psychologist was quoting during this TED Talk. And the TED Talk is called Let Stress Be Your Friend. So if you Google on TED Talks, that's what you would want to Google it under. And it was a psychologist. And she quotes this study. And it basically talks about our perception of stress. Like, does that have an impact on how our body responds to stress? And I bet you already know the answer to that question. But the study basically tracked 30,000 adults for 8 years. And before the study, they asked 2 questions. They said, are you under a lot of stress? Do you think that that stress is harmful to your health? And then what they did is they used public records to see who died. And what they actually found were the people that perceived stress as harmful to their health had a 43% increased risk of dying. So people that did not view the stress, so they had the same level of stress, but they looked at, it's more of a challenge, I'm going to grow from the stressor, had like the lowest risk of dying. They were actually the same as the people that had no stress at all. So really interesting that when we look at, adrenal health and our perception of stress, and we look at, meditation, deep breathing, and even like how we view it is really, really important. It's a very important educational tool when we're talking to, I know when I'm talking to my patients, but also when you're talking to your clients about that. So I really encourage you to watch that TED Talk. She ended up getting a standing ovation. Really, really interesting. So I just threw this quote in there because I thought it was really cute, but it kind of sums up that study. But being negative only makes a difficult journey more difficult. You may be given a cactus, but you don't have to sit on it. I also just wanted to share a testimonial with all of you. I get sent, obviously, lots of emails from people all over North America, but this was a Facebook message that somebody sent to me, and this is why I love what I do. When I get patients and come back with really great results, or I get these little testimonials that are sent to me through email or Facebook. And she said, Sarah said, in just 10 days, my skin has cleared and I feel a significant reduction in any feelings of being overwhelmed due to stress. Thank you for recommending the AdrenaSense and the AstroSense. So that was excellent. These are sort of the core products that I talked about, the Women's Sense 4 Core, but we have a lot of other ones and we have new ones coming out as well. So thank you everyone for your attention, and these are my books also. I didn't mention this at the beginning. But I have 3 books. I have Make Sense of Women's Health, The Adrenal Stress Connection that I did write with my mentor and colleague, Dr. Karen Jensen, and then I have a new book called Collagen Myths and Misconceptions that just came out in the fall of last year. And this is how you reach me, drmarita.com. So I encourage you to follow me on Facebook and Twitter. I have a monthly newsletter. I do really love to cook as well. So I like to post healthy recipes and smoothie recipes, and yeah, my travel schedule is usually on my website as well. So thank you so much, and I see that there's a few questions here in my little chat box, so I'm going to address those. Or would you rather me?
I'll ask the question.
Or do you want to ask? Why don't you ask the question and then I'll answer it? That's right.
So everybody, if you have questions, please type them in the chat, and I will read them out loud so that they make their way onto the recording, and then Marita can answer them. And if you'd like, you can come out of screen share so we can see your lovely face. Okay, so the first question here is from Modest, and it's, can you give ThyroSense if a client is on Synthroid and has had thyroid cancer and has her thyroid entirely removed?
So that's a really excellent question, and I've done research on that. And because a lot of the conversion of T4 to T3, a little bit does happen in the thyroid, but a lot of it does happen in the peripheral tissue. I will recommend taking the ThyroSense, again, spaced from the Synthroid, but because it'll still optimize that only that T4 that they're getting from the Synthroid. But then also you want to remember to address adrenal health as well, because somebody who's had thyroid cancer, obviously their body has gone through a lot of stress, especially if they've had their thyroid removed as well.
So basically you're saying that because the liver's still converting T4 to T3 that you recommend the EstroSense? Because
the ThyroSense. I thought it was a ThyroSense.
Sorry, ThyroSense.
Yeah.
Sorry, mistake. Yeah, because I've been asked that question a million times and I never had the answer for it, so thank you for that. I never thought of that. Okay, so Jody is asking, would you recommend starting EstroSense for a 17-year-old female who is taking birth control pills?
So, preventatively, because what is the birth control pill? The birth control pill is synthetic exogenous hormones that is putting more stress on the liver. Yes, I would probably recommend at least just one capsule a day as maintenance. It would be interesting also to find out, are they taking the birth control pill, like are there any other underlying issues? Like are they taking the birth control pill for hormonal acne, for painful cycles? Is it just for contraception? So, you know, you want to sort of, you know, investigate a little bit further.
Okay, it takes them a few minutes for them to type in the chat, so I have a couple of questions here myself.
Mm-hmm.
The first one is, you know the chart that you had up that had the estriol on it?
Yes.
You had the chart that showed the 16-hydroxyestrone, bad estrogen, and then the estriol underneath.
Yes.
I didn't quite get that because my understanding is that estriol is a weak estrogen and not considered particularly powerful. Did I miss something about, because I can't remember what the total purpose of that chart was, did I miss something of how it went from being 6-hydroxyestrone to estriol?
Yes, and I know that chart, I've been trying to figure out how I can make that chart a little bit better, like easier to understand. So what happens is that instead of it converting into more of the weaker, more protective, it'll convert into the 16-alpha-hydroxyestrone. So ultimately, if you're taking things like DIM and I3C and calcium D-glucarate, it'll help to drive it more into the protective versus instead of it coming down as like 16-alpha and then estriol, which is how I think it is on the chart.
Okay. Jody was just following up saying that the young 17-year-old is taking it due to painful cycles, which have caused her to pass out many times.
Yeah, so even more reason to take the EstroSense in that case. And she probably, I mean, you'd probably even want to look at magnesium as well, Vitex, like other ingredients, and then strongly look. I find with painful cycles, also, you know, omega-3s, GLA, diet, dairy, sugar, like some of the, you know, again, common sense basic stuff for us, but, you know, a lot of times, a lot of people don't realize that.
Okay, so Rebecca is asking, can you clarify what the Eleutherococcus, I'm not even going to say this right,
Eleutherococcus?
Please.
So Eleutherococcus is Siberian ginseng, and it's a very potent adaptogen. So it helps your body increase resistance to stress.
Okay, and Rita would like to know, would you recommend EstroSense in a 20-year-old university student who may have slightly irregular menstrual cycles?
Absolutely. So that can be something, because I often get that question because people say, well, should I be taking it only a certain time during the month? So in that case, I would recommend 1 to 2 a day throughout the month.
Okay. All right. I had another question. I was making notes as you were talking.
Perfect.
So you were talking about TSH levels.
Mm-hmm.
And, I believe, if I understand correctly, those are blood tests if you want to get them tested by the doctor. Okay, so can naturopaths order that test? or do you have to go to an MD to see that?
No, we can, we have lab access. We can test for all, like we can do a full thyroid panel. It just typically isn't covered under the provincial medical plans. So typically people have to pay out of pocket to get those tests done. So the way that I get around it in my office is I have medical doctors that I've developed really good working relationships with. So I can send my patients there and I can say, can you just have Dr. So-and-so test these, and then they can just send me the results. And it saves the patient or the client money having to pay for it themselves. Because to do a thyroid panel, I believe it's about $80 to $90. So it can get pricey.
Okay. Have you found that the medical doctors are willing to run it when you ask? Like have your patients?
The ones that I know well and that know me well in the community, there are some doctors that kind of get their backs up and they'll say no. So it depends on if I know the doctor. If I don't know the doctor very well, then I'll just say, you know what, just get the TSH levels checked, and then we'll do the other ones. Like we'll do the T4 and the T3, and we'll do the thyroid antibodies if they don't test that one. Okay. So I kind of fill in the missing blanks.
Okay. So Rita just wanted a clarification of how many months or for how long should the person be taking the
I would say for at least, I would do it for at least 3 cycles.
Okay. And, sorry, I can't see what it looks like it says JJ. Once the body rebalances with these products, does one need to continue it, or to continue, if practicing good lifestyle, can the body-mind not keep itself in hormonal balance?
Yeah, that's a really great question. And we have to remember, like when we're talking about supportives, whether it's adrenal support or hormone support or liver support, obviously everyone's an individual, and what one person may have to stay on something longer for their specific program. One person might respond a lot quicker. My sense with adrenal support, because the adaptogens that I mentioned, a lot of them are very gentle. What is the definition of an adaptogen? Adaptogen is meant to not do any harm to the body. It's there to give yourself the reserves and the resistance in case you come into contact with a stressor. So I kind of feel like with adrenal support, that's sort of a really good general health maintenance that most people should probably be on long term. And the same thing with, your basics like your fish oil and your omega or your vitamin D. But, maybe for like the Estrosense or the Thyrosense, if the adrenals are working well, maybe they don't need the Thyrosense, because once the adrenals are restored, then the thyroid, can work better and more efficiently.
Yeah, I'm assuming that people can tell when they've been on these for a while how they're functioning. Would you recommend that if they're not sure that they're going to function on their own, that they come off it for a week or two or a month or something, maybe a full cycle, see how they are, and then if they don't find they're maintaining what they gain, go back on it? Does that disrupt anything if they do that?
Yeah, I would sort of assess every situation. For example, if somebody was under a lot of stress, they were a shift worker, or they had a really stressful job, stressful family situation, I probably wouldn't recommend that they go off their adrenal support. But say they, eat really well, they exercise, they're kind of doing it more, or they had like a stressful situation, they want to get themselves feeling better, and then they're feeling fantastic, then I would say yes, we'll lower the dosage. Don't take 3 a day, take 2 or 1 a day. Or, take a break for a couple weeks and see if it, makes a difference, or, and then your body will tell you if you need to get back on it. I also use, like I have questionnaires that I often use. There's an adrenal stress questionnaire in my purple book as well as the orange book, the adrenal stress connection book. So those are, again, really great tools that you can give to clients and say, okay, let's do the questionnaire at the beginning, and then let's do the questionnaire in like 2 or 3 months. And then you can compare the numbers, and then you can see, okay, well, have these symptoms improved? Are you feeling better? And then you obviously, you do a case or a visit with them. And then those are other ways of determining whether or not they need to be on a higher dose or a lower dose, or maybe, take a break from it for a while.
Okay, so here's an interesting question. Rebecca's asking about her daughter who's turning 11 and is blossoming, but hasn't got her period yet. Is there a way to keep the period away a little longer? She said she was 11 when she got hers. And is EstroSense applicable here? And she says, what's the youngest age where EstroSense might be appropriate?
Yeah, so that's a really excellent question, and I'm glad it was brought up, because you don't want to be giving EstroSense to any girl, or actually EstroSense can be taken by men as well, but you don't want to give it to them before they've gotten their period. So it's only from puberty, so once they've started their menses, onward.
All right. Does anyone have any more questions? Like I said, there's a sound delay here, so they hear what I say a couple minutes after I say it, or we say it. So they're still hearing your answer right now.
Oh, okay.
And then they're going to hear this. That's the only issue with this particular system. So if you want to type any questions you might have into the chat box, that would be great. All right, Jody has said, I have a case study who is a 45-year-old female taking Synthroid and Cytomel. Cytomel interferes with the absorption of vitamins and minerals, and the vitamin supplements interfere with the absorption of Cytomel. Well, that's convenient. Could she take the ThyroSense later in the day? Do you think that would be effective? She has a stressful job and has had severe fluctuations in her thyroid levels and is followed every 3 months by an endocrinologist. Would you recommend adding AdrenaSense supplement instead?
Yes. So in this case, because she's taking the Synthroid as well as the Cytomel, so she's actually essentially taking T4 and the T3, I would probably recommend giving her adrenal support, especially because she's in that stressful job. So I would start there before I would recommend the ThyroSense. But I would also make sure that she has had her thyroid antibodies checked as well.
Yeah, that's complicated.
Mm-hmm.
Are you familiar with that drug, Cytomel?
Am I familiar with Cytomel?
Yeah.
Yes, I've actually prescribed it in certain circumstances.
And is it for thyroid or is it for something else?
No, it's for thyroid.
And how does it? I'm sorry, I'm just curious. How does it differ from thyroid? Synthroid is a synthetic thyroid hormone, correct?
So Synthroid is essentially T4, and Cytomel is T3.
Okay.
So
but is it
for people that aren't converting, what the doctors think, okay, well, you're not converting if they have like adequate levels of T4, but they're still having low levels of T3. Then their thought process is, okay, we'll just give them T3 then. So then they prescribe the T3 to be taken with the T4. But it's a very fine balance. Like I prefer not going in that direction if I don't have to.
And is Cytomel synthetic as well in nature?
Yeah. So it's different than, say, taking like Armour or desiccated thyroid.
Right.
So Armour or desiccated thyroid is more like bioidentical thyroid glandular. So that I will use before I prescribe Synthroid or Cytomel.
Okay. Well, that was going to be my next question. Is there a, a non-synthetic T3?
Yes, but well, in BC, it's only available through prescription. Like you can't get it off the shelves. You can't purchase it in a health food store.
Yeah, no, I would expect that, but it's nice to know that it exists because
Yeah, it's called desiccated. I always get it mixed up because I think it's called Armor Thyroid in the United States. It's called desiccated thyroid in Canada.
okay. All right, so Rebecca's asking, I understand Synthroid causes the thyroid to basically stop working on its own because it's grown dependent on the Synthroid. Would ThyroSense work? So excuse me. Would ThyroSense work that way too, or does it assist the thyroid to start functioning on its own properly?
So the ThyroSense is very different than Synthroid because it's not just giving the body thyroid hormone. So it's assisting the thyroid to function better, and it's giving the essential minerals and vitamins and herbs to help to optimize thyroid function. So it's very, very different than actually taking the thyroid medication such as Synthroid, the hormone on its own. So I wouldn't compare it to the Synthroid at all. But whenever somebody comes in with thyroid issues, again, remember, try to figure out, okay, what is triggering the thyroid to go out of balance in the first place? Is it coming from the adrenals? Is it coming from too much gluten? Is it coming from heavy metals? Are they not getting enough iodine in their diet? Like, these are all things that you need to figure out, because the issue with doctors is they just say, oh, okay, well, your blood tests say that you have low thyroid. Here, go on the medication, but they don't really do the investigation of like why they have low thyroid in the first place. And you know what? There are some people that just need to go on Synthroid in certain circumstances. So you need to, I guess, know when to refer. If somebody has a TSH at like 9, to wait for the Synthroid or the ThyroSense to kick in and work, well, those people would probably need to go on medication than a supplement.
All right. So I'm just waiting. We can just wait a few more minutes to see if there's any other questions. It is a very complicated scenario, isn't it, when you're trying to figure out what's the best approach for everyone's hormones, isn't it? Very complicated.
Oh, it is. And, and that's the other thing, sometimes if a woman comes in and she's been really miserable, like menopause, for example, if she's been miserable, she hasn't slept in like 6 weeks, and she's hot flashing every 5 minutes, I know that the MenoSense in some cases may work within, a couple weeks, but in those cases when they've been suffering for so long, I will tend to prescribe like a low dose, like a progesterone cream or a biased cream, just to kind of give them a little bit of like, just so that they can sleep and stop hot flashing. And then I can assess, give them adrenal support, because adrenals don't just restore overnight.
No.
Adrenals take a long while to recover in some cases.
Well, and people don't understand or may not know exactly how burnt out their adrenals are.
Yeah. You always just have to use, the example if they say, oh my goodness, I've had stress for the last 15 years. And then they ask, okay, well, if I take this adrenal support, am I going to feel better next week? Well, you need to just remind them that they've had stress for 15 or 20 years and that, their adrenals are not just going to recover overnight.
All right, so Liz says, how about Hashimoto's? Would supplementation help there, or Synthroid is the way to go?
Yeah, that's a really good question. So with Hashimoto's, so for people that don't know about Hashimoto's, it's an underlying autoimmune thyroid disease. So it's still hypothyroidism, but there's an autoimmune component to it. Most people with Hashimoto's do get put on the Synthroid, or they'll get put on like a desiccated T4, T3 combination. You have to be a little bit careful with iodine in certain cases. There's controversy with regards to iodine in Hashimoto's. So they say if you're going to use, like, if you were going to use ThyroSense in that incidence, then you'd want to make sure that you're dosing selenium with it. And I've been actually working with Preferred Nutrition to add in selenium to the formula, because I think that would be really good too.
Okay, so how do you interpret the test levels for thyroid? Do you ask clients to take temperature as well and use their self-report to interpret the test results, because there's so much controversy about the low numbers?
Yeah, you can definitely do basal body temperature. My experience with that is that you want them to do their temperature for at least a couple of weeks. So in the interim, if they have had their TSH levels checked or they had their T4 and T3, for me to wait for them to do basal body temperature as well. Usually I'll just use the numbers. And I know, like, if their TSH value is like 5 or 5.5 or 4, it's above 2, then I know, okay, the thyroid is suboptimal. But yeah, you can use basal body temperature.
Well, that ties into Elizabeth's question about TSH of 5.5. Is Synthroid necessary, or can it be reduced with ThyroSense? In addition, she's added, in addition to supporting the adrenals.
Yes. So in that case, because they're just sort of sitting on the borderline, I would tend to recommend doing the AdrenaSense plus the ThyroSense.
Okay, and Jody would like you to repeat which products you take on a daily basis for yourself for health maintenance.
So I take EstroSense and I take the AdrenaSense.
Rita would like to know, what would you recommend for a 49-year-old perimenopausal woman who has no other symptoms except maybe irregular period or missing period and some memory fogginess?
So the irregular period and the missing period, I don't typically worry about in a perimenopausal woman, because that's one of the symptoms of perimenopause, unless she was having extremely heavy cycles or a lot of cramping. But if she's just sort of missing a period per month, or a couple months go by and she has a cycle or a period and it's normal, then that's okay. Memory fogginess, because she's going towards menopause, I would definitely look at, again, adrenal support.
Okay, and then Rebecca, she says, so in my case, I was always borderline underactive thyroid, and I always resisted Synthroid. I eventually did go on it when my doctor scared me when I was pregnant with my children. But I'm still off it now, and I'm trying to address it naturally. Working, but it's slow, of course. You mentioned TSH9, which is my number, that they should be on meds until supplements kick in. Do I need to? I feel improvements and have been working on this for a while with her naturopath and her doctor, and her number was 13 before.
You know what? If you're seeing results and improvements, because you were 13 before and now you're 9, that's a good improvement. And as long as you're not having extreme symptoms like extreme fatigue, cold all the time, brain fog, mood issues, depression, anxiety, then I would continue on your route, especially because you're working with an ND and your medical doctor. So at least you're being monitored. You know, it's one thing being monitored and working with practitioners, and then another being like, oh, I have a TSH of 9, I'm just not going to do anything about it. So, or I don't want to go on the medication. So as long as you're taking, like, I'm sure you're on a really good program and you're seeing improvements, then I just stick with what you're doing.
Okay, well, we are almost at the 9:30 mark. I'm going to assume maybe there's no more questions. We'll know in a couple of minutes. As I said, there's a bit of a delay. So we'll just start to wrap up. So if you have more questions, do you mind being emailed, Marita, if they have any more questions?
No, not at all. I have on my website, drmarita.com, there is a little spot on there that says Ask Dr. Marita, and whenever I lecture, I say, feel free to email me if you have any difficult cases. Be patient because sometimes I don't get a chance to email back right away, but I usually try to email back within, a few days. So.
Okay, well, in that case, then we can wrap up now, and I'll be sending out the PDF of the slides tonight, which is great because there's some wonderful statistics and study examples in there that will be very useful for everyone. And I will include her contact information and her website, even though it's on the last page. I'll also put it in the body of the email, as well as the quiz for those of you who need it for either practicum hours or CEU credits. So on that note, I'd like to thank you very much, Marita. This has been a very interesting talk, a lot of good new information, and a lot of a reinforcement of some of the concepts that we already were somewhat familiar with, but to hear your take on it and to sort of see the case studies that sort of back up that this was helpful for them was really, really strong in my books to reinforce the information that you were presenting. So thank you very much, and everyone, thank you for attending, and we will call it a night. So good night.
Thank you.